Hello, everyone. Good evening. My name is Jaclyn Tomsic, and I am a board certified oral and maxillofacial surgeon. I practice in Cleveland, Ohio. As you were probably tuning in, you may have just heard a little bit. I practice as in a group private practice with 4 other surgeons, and I also have a part-time staff position at an academic institution as an attending for our oral surgery residency. I'm staff at our one of the major hospitals here in Cleveland, University Hospital System, which is a level 1 trauma center. So I take level 1 trauma, facial trauma call there as well. So I work about 5 days a week. So I am currently on call this weekend, but so far, knock on wood, it's been pretty light and calm. Plus I have the residents who see things first. So I shouldn't be interrupted.
All right, well, thank you so much. We're so glad to have you here. Again, hi, my name is Isabel. I am the co-founder and CEO of Generation Med. We're a nonprofit group dedicated to medical education and connecting students like you to physicians like Dr. Tomsic so we can have better education and medical education during this pandemic. So once again, the format of this event is we will have a host Q&A session where I will ask general questions, for example, like what is OMFS? Can you describe more about your fellowship or your residency, as well as your college experience? And then you guys can ask more directed questions in chat. Yeah, but other than that, well, when we move on to the participant Q&A session, we would also love for everyone to turn their cameras on so we can have like an open conversation about with Dr. Tomsic. So let's just get started with probably the biggest question everyone asks a physician. Why did you choose OMFS to specialize in?
Sure. So a number of reasons. For me, I really kind of realized that I like surgery and medicine together. So OMFS for me really kind of combined those 2 aspects. I always knew I wanted to be a doctor in some way. To be honest with you, I kind of went into it not knowing or not thinking much about it, which is why I originally, I started out in dental school, went to dental school, kind of found out that it was fine and fun, but I really didn't ever see myself being a dentist, and thought about possibly just going to medical school, but then was introduced to oral and maxillofacial surgery, which is a collaboration, a combination of medicine and dentistry. So it allowed me to use my dental background and not have it go to waste, but also fulfill my passion really for medicine and surgery as well. So that's kind of how I got to where I am. And I have really enjoyed it, obviously. So just a little bit about oral maxillofacial surgery. So like I said, I started off in dental school and then decided that I was going to pursue oral maxillofacial surgery. And it is a matching program, like all medical specialties. So you apply and you're matched into a program. My program was in Detroit, Wayne State University. So as part of that program, for me, I matched into both the residency program and a medical school program. So when I went to Wayne State, I was accepted into the medical school. So I went to medical school at Wayne State. And then I was also accepted into the oral surgery training program. So I also did my oral surgery training there. So I was there for a total of 6 years. And it kind of is an integrated program. You go back and forth kind of between residency and medical school throughout those 6 years. And because I had completed 4 years of dental school, I did not have to do the first year of medical school. So I only did years 2. I was given credit for the first year of medical school because I had completed dental school. So then I only had to complete years 2, 3, and 4 to graduate, alongside my colleagues, and obviously took all the same medical boards and tests that you take for medical school. So I probably kind of went into a second question with that answer, but.
No, that's quite impressive. The journey from dental school to medical school shows like the flexibility in education there, and at least it's never too late to change up what you're interested in.
Oh no, absolutely not. In both medical school and dental school, I had many, classmates that, this was their second career. Essentially, they had done, other things in dental school. I had a couple classmates who had been hygienists for a number of years and decided they wanted to go back to dental school and medical school. I had a number of classmates who had been like EMTs or had worked like as techs or, other, positions in the healthcare field. And I even had some who were like, I can't remember what exactly, but I had a classmate who was in finance for like 5 years and decided that he wanted to go to medical school. So it really is, you don't have, that's the quote unquote non-traditional med student. I think that has become, I feel like more of a kind of hot term or whatever that was not really used when I was there, but that's essentially, when I was in school, we had non-traditional students as well. So no, it is never too late.
Yeah, absolutely. And then after medical school, of course, there comes the residency. So do you have any stories from your residency? Like how long did you spend there? Any rotation stories?
So so as a surgical specialty, I spent my intern year. So intern year is always the first year after medical school. All residents are technically called interns. So I spent my intern year as a general surgery intern, which is very common for a lot of surgical subspecialties like mine, oral maxillofacial surgery, like plastic surgery, ENT surgery, a lot of even ophthalmology, a lot of the surgical subspecialties, or urology, that's another one. So I spent a year as a general surgery resident, and then I was an oral surgery resident for 3 years. So, there's all kinds of stories. I mean, for me, I really thrived in my general surgery year. We had a very team approach. The program that I was in, every service that you were on, it was a team of all different levels. So there was me, like the interns, there was usually a group of us, and then there was usually what they termed a junior level, which is maybe even a second or a third year resident. And then there was a senior level resident who would be the fourth or the fifth year resident. And I really like that approach. You really learn a lot from everybody, and everybody kind of has their different roles. I do remember just, that was at a time that, we would take 24-hour calls, and our maximum time that we were allowed to be on call or working was 30 hours. So you would take a 24-hour shift, and then you would have 6 transition hours to sign out and finish whatever you had to do. I think it's changed now. They do more shift work as an intern, but I remember those times where I literally felt like I was like The Walking Dead. I hadn't slept for literally over 24 hours straight, and you think that you can't, go on, and then you just get that second or third win where it's just like you're running on fumes and you don't know, what's left or right, but you're just doing it. Gosh, I remember, a couple stories. I remember the first time when I decided to get the ugly Dansko shoes that you see that a lot of doctors and surgeons wear, because as an intern, I was told we had a gunshot wound come in. We were waiting for the OR, so I was told to sit with the patient in the pre-op area and hold pressure to his abdominal wound, which was his liver. So as I was doing this, after 15, 20 minutes, I looked down and realized that it was bleeding into my shoes. And so those shoes were, done. So from then on, I got the shoes that were easily washed off. A lot of trauma. I saw a lot of trauma in Detroit. So that definitely never got old. I mean, some very unfortunate trauma. I did see someone who worked in a factory and with very hot plastic. It was some kind of plastic industry where they heated plastic to, very high temperatures to mold them into things. And unfortunately, they injected hot plastic into their hand, which was very devastating. That patient that ended up having to amputate his hand because it was essentially plasticized. So I definitely saw a lot of trauma in Detroit. So, which looking back, I thought that was like normal, that everybody saw that all the time. And then when I kind of moved on and went to other places during my career, I realized that not everybody saw everything that we saw there. So I did feel kind of lucky to be able to see that, to have that experience at a very inner city urban training center like I did in Detroit. So
Yeah, that's scary. I actually did an internship in a hospital in Baltimore. I want to say 2 summers ago, and I kind of experienced something very similar, as in like it was very different from like big cities hospitals versus suburban hospitals, or like suburban clinics have very different like patient demographics, and it's very interesting seeing the difference between how like one place handles their healthcare and patients versus another place.
were you at shock trauma?
Not really. It was just very much like, wow, everything is just so new to me right now. And everything's a lot more fast paced and intense than I thought it would be, as opposed to so I'm currently working in a clinic where it's like a lot less fast paced because it's family medicine. So a lot more of it's just focused on long-term diagnosis rather than like an emergency medicine kind of environment, you know?
Yeah, and your point that you made, there is a difference between like urban hospitals and more suburban, and then rural hospitals. So in my previous job, I worked at a suburban level 1 trauma center. So we still saw significant trauma, but it was definitely different. Whereas in the urban center, like I was in residency in Detroit, we obviously saw a lot of gunshot trauma, like direct gunshot wounds, penetrating trauma like stab wounds, and kind of fistfights, assaults, a lot of that kind of stuff, some car accidents. Whereas in the suburban trauma centers, you see more motor vehicle accidents, bike accidents. You really don't see any of the gunshot trauma or the assault trauma that you do in the inner city. Unfortunately, the only gunshot wounds that you usually see in the suburban centers are self-inflicted, which is a whole nother has a whole another dynamic on top of the trauma. So that is a very good point. In the rural areas, I've never really worked in a rural hospital, obviously, but they have their own different experiences as well. All great, different experiences. Just kind of what you ultimately like thrive doing. But it is great that we have these different options to kind of explore medicine.
Yeah, absolutely. Every setting is just so different, and being able to adapt is very important in medicine as well. So that leads me to my next question. What made you go from like working in a hospital in Detroit to where you are now?
So Detroit, like I said, was my training hospital. So I spent 6 years there. And then after I finished training, I did do a fellowship. So my fellowship was in complex, what is called orthognathic jaw surgery, which is jaw repositioning surgery, mostly for people who are born with jaw deformities or jaw discrepancies, and require jaw positioning surgery for a number of reasons: functional, speech, issues. They have swallowing issues. They also have breathing issues leading to sleep apnea, as well as cosmetic issues. So that was in Georgetown University in Washington, D.C. So I went there, and I was there for 2 years following my residency, which was also a great experience. And then from there, I took my first job, which was actually in St. Louis, Missouri, which I knew nothing about. And that's where I worked in the level 1 suburban trauma center. So my specialty is unique. We really, most of us are not employed by hospitals. A lot of all kinds of doctors, you can choose to be kind of in a private practice setting, or you can be employed by a hospital system. So for our specialty, we're very active in the hospital, but not a lot of us are employed by hospital systems. So that is my experience. So I also there was actually employed and worked primarily for a group practice in St. Louis, but then I also was staff at the hospital and took trauma call as well. So I was there for 5 years, and it was a great experience. I really liked the hospital system. And I just got to a point where within my own group practice, just kind of felt like I was at a point where I wasn't, there was no more growth. So it was not an easy decision to make, but I did make the jump. And because it took me a while to find another position that I really wanted, a similar position to the one I had, because I like the combination of working in the office and working in the hospital. And so that's not always the easiest position to find. So I researched for over 2 years, actually. And then I took a job here in Cleveland, which the reason was Cleveland. I am from Cleveland originally. I was born and raised here. I went to undergraduate school here in Cleveland, and then went away for all my training, and was traveling through different cities through all my school and all my residency, and for about 18 years. So when I saw a job position here in Cleveland that that kind of checked all my boxes, kind of made it a little bit sweeter that it was in my hometown. So now I'm back here. I've been back here for about 1.5 years. And like I said, I get to work with a residency program, which I had not been able. There is no oral surgery residency program in St. Louis. So that's been a real kind of joy and thrill for me, being able to work with residents and be a part of that whole environment. It is very fun. And getting to teach, kind of thinking of myself being in their shoes, being in their position, kind of thinking like, what did I want from my attending when I was in their shoes? So that's kind of like how I try to teach them. So that's really, and I just really enjoy that, getting to work with them and seeing them kind of grow and getting to know them. So I really enjoy that. And then, like I said, I work in my office about 4 days a week, private practice, just outpatient office. So that's how I got to be where I am, and it's been going good so far.
Yeah, it seems like it. It's crazy how medicine can take you all over the country, or even all over the world if you choose. Like, you seem to have moved around a lot.
I will say that that's a great point, and I would tell all of you, listening and pursuing a career in healthcare, take advantage of that. I think that is really one of the built-in, just awesome, just experiences that we get. Obviously, some people have family obligations and want to stay in certain geographic areas because of that. But if you have the ability to travel and get out of your current wherever you're from and experience another place, I just think I completely, that's one of my greatest accomplishments. And it's one of the things that I love the most about my training, because it gave me the opportunity to do that. Like, for instance, when I applied to dental school, I had been in Ohio my entire life and I was ready to leave Ohio. I could have gone to Ohio State University, which is a very good school. Would have been a lot cheaper, but I really wanted to, I wanted to go to the East Coast. So I went to Boston, and, to this day, I'm in love with Boston. It was a great experience. And, I'm so glad that I took that experience. And then from there, I've lived in, multiple cities. Some of them I never would have thought that I've lived in, like Detroit. Never would have really thought of living there, but it was a great experience. I love my medical school. Wayne State was just an amazing education. I just loved being there. I met so many great people. Again, like I said, my clinical experience, I think is like second to none. I think we got an amazing clinical experience there. And then again, my fellowship, I got to go to DC, which is just an amazing experience in and of itself. For me, one of my kind of like hobbies personal hobbies is history. I love history. I don't get to read about it as much as I'd like, but to be able to live in the nation's capital was kind of really just fascinating for me. So when you think about it that way, I think that medicine, your journey through medicine, it's long. Obviously, it takes a lot of dedication, but you can really make the most of it. You can really get a lot of experiences. Also, when I was in medical school, I went on a mission trip to Guatemala. We called it Alternative Spring Break. So a group of, I think, 15 of us went down to Guatemala during our spring break to provide medical care. That was an amazing experience. You don't realize it, but you do have so many opportunity, available to you if you choose to take it. And I would encourage you to, take it if you can, because I guarantee you, when you're in my shoes, like 10 years out, you'll look back and be like, gosh, I'm really glad that I had that experience, because once you get older, it's a lot harder to pick up and move, like it is when you're in your 20s and, kind of just experiencing life.
Yeah, absolutely. And besides like taking advantage of all the opportunities we have, do you have any other advice regarding like college classes, college planning for us pre-med university students?
Basically all I would say is, focus on getting a good GPA. It sounds, kind of cliche, but it's true. Med schools look at your GPA. You have to have a decent GPA. It's just one of those things that they use to weed out, because medical school is, a grueling grind, like for 4 years. It's very demanding. And it doesn't necessarily matter what your degree is. Obviously, I would say the majority of students do choose a Bachelor of Science in some way, shape, or form. Like, I was a chemistry major and biology minor. Most people are biology, chemistry, one of the sciences, maybe physics. But you don't have to be, if you have a 3.7 in business, those are tough courses too. So really, I would just focus on, doing something that you enjoy and that you're and put in the time to perform well, because it is important. Obviously, with medical school, you are going to have to take some classes for requirements, prerequisites. So if you take if you do a basic sciences or Bachelor of Science, you really don't have to worry about that, because it's built into your degree criteria that you have to take for your degree. So you don't really have to worry about that. If you choose a more non-traditional major, like for instance, business or marketing or communication, something like that, just make sure that you get in the requirements that you need for application into medical school, because that's important. Otherwise, if you don't have them, you're going to have to take them, before application, before applying. So those are really the two things that I would say to focus on. Other than that, have fun in college. College is meant to be fun. They like to see extracurriculars. They like to see that you're a well-rounded student, because medicine, unless you're going to be a pathologist or radiologist, you're not, where you're sitting in a dark room all day without actual patient care. You are going to have to interact with people. So they want to see that you're a well-rounded person, and that you get along with people, and that you're just passionate, about, dedicating your life to medicine and being a good doctor.
It's funny that you bring up being a non-traditional major, because that's actually the path I decided to take in college. I'm currently a business administration major with like a 3.8, 3.9, GPA, it's above average. But yeah, absolutely. As long as you take the prerequisite courses meant for med school and like talk to your college med school advisor, really you can major in anything and still pursue medicine. So one of my last questions here is, with everything you said so far, what are your future goals in healthcare and medicine from here? You mentioned you're in a private practice right now, so, and also educating. So any future plans?
Yeah, I feel like it already has, and it will continue to just change and evolve throughout the course of my career. But some of my, current goals, like I said, I just moved to Cleveland a year and a half ago. So my goal is to kind of establish myself as a leader in my specialty, a leader, especially in the surgeries that I really am passionate about, which are the orthognathic jaw surgery that I did my fellowship in, sleep apnea surgery, and facial trauma surgery. I have obviously a strong background in facial trauma from my Detroit days. So that's one of my goals. Also just to, increase visibility, knowledge, and interest in my specific specialty to the community, to try to be a role model to students and those interested in medicine, surgery, not just my specialty, but anything in the healthcare field, particularly other females, other women, particularly in surgery. Because I know that obviously is something that sometimes it's harder for females, but we're definitely growing by every day, and really just to help others who are interested in pursuing a career in medicine or surgery or healthcare, to show them through just my experiences, how they can achieve both their dream of pursuing medicine and having that passion, as well as having a well-balanced life and a happy personal life as well. As they quote unquote, to be a little bit cliche, to show people that you really can have it all. So those are my goals. And like I said, I really do feel lucky and privileged to be able to do that, especially now through residence, to kind of, help them. It's always very humbling for them to say they look up to me, because, I just tell them, you're going to be me in about 5-10 years. I mean, it doesn't seem that way, but I was you. I remember being you. So.
Yeah, your platform is super inspiring too. Just to talk a little bit about your Instagram, it's huge. And I love like all the medical education you put on there, not only on your story, but posts and highlights. It's very well organized.
Oh.
But yeah.
Well, thank you. It's a lot of work, but it's very fun. And I do just get a lot of just encouragement and inspiration from people like yourself, groups and organizations like yourself with such positive feedback. It's interesting. I mean, I talk to my residents about this all the time. When I was them, I say, I remember being you, and I do remember there was no Instagram when I was a resident. There was Facebook, but it was a whole different, it wasn't anything like it is today. So it's fascinating, the resource that they have. And obviously you're not going to study for your boards. You're not going to study for your exams through Instagram. And that is not, my goal. you know, but it is just another layer of information and education that you can get to kind of like reinforce what you're learning and what you're going through. I also think it's very cool that, you know, residents have that platform to kind of see other people who are in their shoes, going through it, kind of connect with other people in that way. And, you know, again, I think that's one of the, you know, many, just one of the positives, one of the biggest positives of social media. There's a lot of negatives, but that's for another conversation. But there's a lot of positives in social media, and I have been pleasantly surprised and just very humbled by the support that I've gotten and all the people that I've met through this platform. And it's really exciting that it can help people pursue their dreams in some small way.
Yeah, of course. And lastly, with the COVID and the pandemic and everything, you said you only moved to Cleveland about a year and a half ago. So that's like just a couple months before the pandemic hit, which is very soon. How's your career been affected by the pandemic?
Yeah, so I started here in September of 2019. So yeah, there was about 6 months prior to the pandemic. I was just reminiscing actually a year ago today, this week, we were actually in the Cayman Islands for vacation. And it was it's just unthinkable to think a year ago. I mean, the world was so different. We had no idea 3 weeks later how things would change drastically. But, you know, I think, you know, I've learned a lot of things through COVID. I mean, my career has been affected in the fact that I've really seen, and, you know, how essential all healthcare is, really, truly. You know, as a surgeon who does treat, you know, for instance, trauma and other facial emergencies, you know, so we never closed down. You know, we had to stop, you know, elective procedures for that 6-week period from pretty much mid-March through April. But we were still seeing people regularly with emergencies, with trauma, with significant facial infections. So, and it really just taught me that, you know, everybody in healthcare truly is really an essential worker. You do not have to be someone who directly treats COVID positive patients to be essential. You know, looking back, for me as a healthcare worker, the cessation of elective procedures during the early phases of this pandemic really kind of showed me how truly all procedures are important. Now, all procedures may not be considered life-threatening or emergent or urgent, but having to suspend all elective procedures put just an unimaginable burden on the healthcare system, beyond anything that you could have, you know, predicted. And that's really going to take a longer time to normalize than the 6 weeks that we had to step back. I mean, hospitals need elective surgeries to stay afloat, really. And it's not only for profit, it's to be able to staff the hospitals and to, you know, stock the shelves with all the PPE that, you know, was such a front and center. Without these procedures, you know, money isn't coming in, and then that decreases your ability to get care, decreases your patient care. You know, another thing that really was, you know, devastating, still is, but not as much to a degree, is, you know, people really, it really discouraged a lot of people from coming for routine care that they need. You know, I mean, COVID is out there, yes, but, you know, heart attacks, strokes, diabetes, all that stuff didn't go away when COVID hit. And I think that's something that was kind of devastating as well. So really, if there's anything that I'd like to say about it, is just, you know, everybody in healthcare is essential. You know, that's obviously that's been talked about a lot over the past 12 months, essential workers. There's so many essential workers, both in healthcare, not within healthcare. And, you know, something like this to me just shows us how important we really are. So never underestimate your role in healthcare, or really just in life.
Yeah. And again, all essential workers are essential. It's why they're called that. And it's amazing that people like you, and especially your clinic, are still in session at this time too. And of course, I feel like you guys are taking major precautions as well.
Oh, sure. I mean, of course. I mean, it's funny because people always said, "Oh, what are you doing differently?" And I kind of was like, "Well, we're not really doing anything differently because we are always practicing sterile, proper precautions, because that's just standard of care." So, but we have the increase. You know, the only thing that's different is obviously, you know, more the increased PPE that necessarily we don't always use on a regular basis, but definitely the sterilization procedures have not changed. I mean, we were doing that before, we're doing it now, and we will continue to do it, you know, once this pandemic is behind us.
Yeah, of course. I feel like the level of healthcare cleanliness is already up there. So there was no worries about that in the beginning. All right. So that was all the questions I have. So if any participants would either like to raise their hand in chat, and then we'll call on you to read your question out loud, or you can leave your question in chat as well for me to read out loud. We'll give a quick minute for anyone to want to do that. But other than that, let's start with the first question from you, where he says, "Hi, thank you so much for talking about your pathway. How did dental school influence your career, and does it still influence your work today?"
It definitely still influences my work today because we work, you know, my specialty is called oral and maxillofacial surgery. So the oral part is within the mouth. So we do draw on a lot of the basic principles that we learned in dental school from just the oral cavity. You know, I always joke with patients, you know, the only thing I do with teeth anymore is pull them out. I don't really do much dental work, but, you know, it definitely influences it. Especially with a lot of our outpatient procedures, for instance, like implant surgery, which is a big part of our outpatient clinic, you know, really draws a lot on the principles of dentistry that we learn, because, you know, once we place the implant surgically, we send them back to their dentist. So we have to kind of have an idea of what they're going to need to do in our placement. So it definitely, yes, does influence my work on a daily basis. Yeah, what was the other part of the question? Was there did I answer the question?
Does it still influence your work today? But yeah, I think it answered the question pretty well. It's nice to see the overlap between so many specialties and fields of medicine as well. Whether it be like, I think the transferable skills is the biggest thing too.
Oh, for sure. I mean, to me, that's also one of the most fun parts of medicine, is the collaboration that you have with other doctors to treat a patient. It's just amazing. So you definitely, you know, it's good to have friends in other specialties, because, you know, you'll need them, you know, and it's good to, you know, have an understanding if someone comes to you with a problem, to know where to send that person if you aren't the right person.
Mm-hmm. All right, so in chat, Katie raised her hand. So Katie, go ahead.
Hi, my name is Katie, and thank you so much for answering all of our questions today. My question is really broad and general. I know you mentioned how you always knew you wanted to become a doctor. I was just curious as to like why you wanted to become a doctor, because I always say that I want to become a doctor to help people, and everyone around me was saying how there's so many jobs that do the same thing and that help people. So I was just wondering how you knew you wanted to pursue this profession.
That's a great question, and that's a great point that you make, because that's a very common answer to why do you want to become a doctor, to help people. And exactly what you said, there's so many jobs that can help people. For me, it was really just the realization and the discovery for myself, my passion for medicine. I really enjoyed it. Like, medical school I loved. Like, there was not, it was hard. I studied a lot, it's stressful. There's a lot of anxiety involved, but to me, just the study of medicine is fascinating. I felt very honored to have the opportunity to be learning it and be there. So for me, that really made it worth it. That's how I knew that I'm doing the right thing. I'm enjoying what I do. And that's what I would give advice that I would give anybody who's thinking about pursuing medicine or any career. Medicine is worth it, but you have to love it. You have to have a passion for it. You have to enjoy it. Don't do it, because you have pressure from your family, or, some people say, well, they think doctors make all this money. Obviously, most physicians, they do make a good living. I'm not going to say that, that's untrue, but there's a lot of other, jobs out there that make a lot more than doctors make. So if, make sure that it's your passion, really, and that you're enjoying doing it. And if you're enjoying doing it, then, it may be tough here and there, but, you will ultimately be happy with what you're doing. So that would be my advice. Just make sure it's truly makes you happy. And if it doesn't make you happy, that's if you start it and you find out that it really doesn't make you happy, that's okay. It's not for everyone. And there's another, fit out there for you.
All right. Well, thank you for that amazing answer.
Thank you for your question.
Yeah, thank you, Katie, for your question.
Oh yeah, thank you so much.
And thank you for your answer again. Yeah, it definitely takes a certain type of person to want to pursue medicine. You have to love it if you want to continue doing it, because it's a lot of schooling, it's a lot of hard work and long hours, especially in residency and fellowship. So the next question in chat is, could you walk us through the general procedure for orthognathic jaw surgery?
Oh, of course. I could talk hours about this, but we'll give you the slimmed down version. So I always start off, because this is kind of like the easiest example. So people with orthognathic jaw surgery, or people who need orthognathic jaw surgery, are born with discrepancies between their upper and lower jaw. One is usually either too small or too big relative to the other. So the most common kind of person that I always point to is Jay Leno. Everybody knows Jay Leno. What do we think of when we think of Jay Leno? His chin, right? He's got this huge chin. Well, his lower jaw is actually too big, okay? But for someone like Jay Leno, he has made his career on his chin, so he is never going to have jaw surgery. But for the normal person, that is a situation where jaw surgery would be required. So there's about 4 different jaw patterns that most people fall under. And once it's diagnosed, then you plan the surgery it's actually a combined surgery with your surgeon, which is myself, and an orthodontist or a dentist who puts braces on to prepare the teeth. So you get braces to prepare your teeth. And then once your teeth are in the proper position, you come to me, the surgeon, and when I was training, we did something very archaic called model jaw surgery, where we took these models and we actually did the surgery on these models before going into the OR to plan it. Well, now, as with a lot of things in medicine, it's all virtual. So we're able to plan this on a computer. We don't have to go through the labor of all these models, but we do plan the entire surgery, the entire movements pre-operatively. And then we go into the operating room. We essentially, and it's essentially all the surgery, believe it or not, is done through the mouth. We don't make cuts on the face. We go through the mouth. We make 2 small incisions under the chin just to help us get some instruments in there. But we essentially cut the upper and the lower jaw. We completely disconnect the teeth part of the jaw from the rest of the jaw. We reposition those. so that they're more harmonious to how we've planned. And then what we call fixate them back together, and that's with plates and screws, which are permanent. So this whole process takes about, depending on the movements, depending on what we started with, and the number of procedures that are required, takes anywhere between like 4 and 6 hours of a surgery. And then they're in the hospital for at least 2 to 3 days. It's about a 5-week healing period, which includes a completely liquid diet for 5 weeks, which is obviously very challenging to do, because when you reposition bones, it takes about 5 weeks for bones to heal, and you can't have bone movement. So when you're doing it in the face, we can't put a caster on the face, which is what you do for a long bone. So that's why people cannot chew, because if they were to chew, then that would move the bony segments and they wouldn't heal. So you have to essentially drink your calories for 5 weeks. So in a nutshell, that's the process. It's very life-changing for many patients. It's a big commitment, but I can say that most patients, once they're healed fully, they are happy that they did the surgery, because of the changes that they've accomplished that they otherwise would not be able to accomplish without the surgery.
Yeah, it seems very specific, but something a lot of people actually need when it comes down to it.
A lot more people need it than you think, and a lot more people, don't get it. But
it happens. So then an anonymous question is, how do you balance your work life, your personal life, whether that be like your Instagram, your fitness, or anything else you like to do?
Well, as a type A person, which many in medicine are, I'm a big, scheduler and planner. So I just essentially plan everything, make time for it, make a schedule, kind of not necessarily always like write down a schedule, but a schedule in my mind. Fitness is important to me. So that's definitely part of my daily routine. I schedule strength training twice a week. So that's kind of accountability in and of itself. Instagram is like the same thing. I just, kind of schedule it when I can, when I get, inspiration or whatever. But also, I schedule vacations. We travel. I mean, not as much right now, but, again, I've always said this, like, I took a long time, I mentioned earlier this evening, when I was looking to make a transition from my previous job, I really took a long time to look for a job that was a right fit for me. And that's important. So because I took that time and I'm at a place where, I enjoy my work life, it allows me to put all the effort into my work life and then enjoy my personal time when I'm not at work. If you want to find a job that is your fit, and that might be location, that might be kind of like scope of practice, might be, again, like we said, working in either a private practice setting or working in a hospital setting. There's pros and cons, to each. You got to find out, which one's going to help you achieve your work-life balance, whatever that may be. So in my opinion, like, if you have a job that you like, it's pretty easy to find the work-life balance.
Yeah, and organization's obviously a huge part of that as well. You're doing so much.
Well, like I said, it kind of, it's so true. It kind of comes hand in hand in a career in medicine.
Mm-hmm. And then our next question in chat is, how is working at a trauma center different from working at your current private practice? Also, on a normal day, how many traumas usually come in versus a busy day?
Well, so, I mean, I guess private practice and is completely different from like a trauma center. They're just two different places. Though, I mean, sometimes trauma does come into the office, obviously not emergent trauma. So But we do get consultations from the hospital, like someone will come into the emergency room. They will have some type of facial trauma. A lot of facial trauma is not emergent. So meaning that a lot of patients can be triaged in the emergency room and then be discharged and sent to us for follow-up. So we do see that a lot. The ones that come into the hospital are kind of more what we call polytrauma, meaning that they have facial trauma, but say they're in a car accident. So they have like orthopedic trauma, they broke their arm or their leg, or they also have abdominal trauma or brain trauma, So usually the polytrauma patients are the ones that come to the hospital and that we see and manage at the trauma centers. It kind of varies every day, what comes in on a day-to-day basis. Like I said, there's no rhyme or reason to a lot of it. They say, in the summer is kind of like trauma season because it's warm, more people are out, more people are, doing different things. So they get into more mischief, I guess you could say, versus like for now in the winter, it's cold, the roads are bad, not as many people go out. So there is some truth to that. There is a less trauma load in colder months, but on a day-to-day basis, it's just random. Some day you could go days without seeing a trauma, and then one day there's like 4 that come in. So it's just random, but that's also why you don't take trauma 365 days a year. That's why you rotate trauma call.
Yeah, and you're also working at numerous hospitals right now as well, right? Or like
Yeah, I have privileges at 3 different hospitals. I work mainly out of 2 of them, and that's pretty common. I have colleagues and friends who are credentialed and privileged out of like 7 or 8 different hospitals. So it really is a personal preference. I prefer to stay to 2 or 3 main places just to make it a little bit more systematic for me. I like that, but to each their own. Like I said, some people like to go to 7 or 8 different places, and you have that ability.
Yeah, that's crazy too. Again, the flexibility there is insane. It's always like a new workplace setting every day, I guess. And then the next question in chat is, how do you think most patients feel about jaw surgery versus regular bodily surgery?
Well, I think that, I guess body surgery, body aesthetic surgery is kind of like more in the mainstream, kind of media, I guess, or just marketing. There's a lot of marketing towards that. I think a lot of people just aren't aware as much of jaw surgery and not only what it can do, but how many people like maybe even could benefit from it. So again, that's one of my goals, is to try to increase, knowledge, educate people to recognize that they need it and to recognize the benefits of it, and at least, have a conversation, about it. I think, in my experience, when you talk to somebody who really needs jaw surgery and you explain to them their condition, the kind of like the etiology of it, like where it came from, what the surgery can accomplish, why surgery can accomplish this over, all other procedures, like why they can't just have a chin implant and this will solve their problem, why they can't just have braces to straighten their teeth, and why this won't solve their problem. When you really sit down and talk to people and explain to them, what the surgery can do, I'm always very happy people can, get on board, and once they understand that, they're definitely more willing to consider it.
Yeah, makes sense. And then the last question in chat as we wrap up is, what is your least favorite part of your job, and what do you wish you could change?
So many. Well, not so many. I mean, it's a tough question. you know, insurance, medical insurances are a constant struggle for any doctor. And I don't have an answer for that. I wish I did. I mean, that's like it's a very complex issue, you know, and with that said, I mean, medical insurance and medical care in the United States is far above any other place in the world. So we're very lucky, but our system is still broken. It has been for years. Medical insurances cover less and less of the cost of surgery, which makes it harder for us as doctors to, you know, to survive and provide the care that we want to provide, because, you know, we're not getting compensated, you know, in a reasonable manner. So that's my least favorite part of the job is having to deal and fight with insurances and, you know, fight with an insurance company to cover a procedure that a patient, you know, clearly needs, but the insurance company doesn't want to cover it because that's what insurance companies do. They want you to pay their premiums, but they don't actually want to have to pay out anything, which again, you know, gets really frustrating from a clinician standpoint when you want to help people, and having health insurance, having medical insurance is essential. I mean, people need it to survive in this country. And it's frustrating when you have to fight with them regularly to cover procedures that patients need. So that's my least favorite part. I wish I could change it. I don't know if I'll ever, you know, want to get on any, you know, political action committees to be part of that. But, you know, I hope one day it will change and be a little bit better for everyone.
Yeah. I know insurance is a huge thing. There's so much, like GoFundMe even made out a public statement that there shouldn't be this many GoFundMes just for people's health cares. You know, healthcare is what I believe is a universal right. And it's crazy that some people are afraid of the dentist or the doctor just simply because they think they can't afford it. So, and maybe to end on a higher note, what's your favorite part about being in OMFS?
I'm just, you know, and this could apply to any specialty medicine, but just helping people. Like, I truly am very humbled every time someone, you know, is grateful and thankful for what I've done to them. You know, the surgery, they're happy with the result. You know, we're always going to be harder on ourselves. Like, we may have wanted, we have a very good result, but we wanted it to be a little bit better. We wanted this to be a little bit different, but truly it's just, you know, the gratitude that I get from patients, knowing that I've helped them, and really being grateful for what I've done to them. Because for me, it's, you know, I've dedicated obviously a lot of time and effort and education to be able to do what I do. You know, many people unfortunately, you know, take that for granted. And many people come in and are very entitled, you know, and that can be, you know, discouraging. But the majority of patients are just so grateful. And especially for me, for being a facial surgeon, especially when I get to either do the jaw surgery or do facial trauma, which is why those are two of my favorite surgeries to do. Facial trauma to reconstruct somebody. That's very satisfying, especially the face. I mean, the face is obviously a very important structure. That's what everybody sees. And if you break your face, like, you want to have your face back. And I'm very privileged and honored to be able to provide that service to somebody and to see them happy and be able to restore to their normal life and function that will never get old.
Yeah, and just the gratitude of patients again, it's just something you can never, it's priceless. And
it is, for sure.
Yeah, other than that, we're going to quickly wrap up. Would you like to leave any of your links in chat, any of your ads, informations, any last minute words?
I mean, thank you all for taking the time on your Saturday to listen. I hope you learned something. If you have, you know, further questions, please reach out to me. You know, on my Instagram, you know, DM me with questions. If you have, you know, any insight on anything, you know, good luck to everybody. on their journeys. I think that's great. You should be proud of everything you've accomplished, be excited about everything ahead. And yeah, just good luck. I'm very, I say this, I'm very impressed, and I just give kudos to organizations like yourself, taking initiative to, stay involved, to make the best of the situation that we're in, to continue to learn and pursue your dreams, even though it may be a little bit more difficult, with a pandemic and not being able to have as much social interaction as we're used to having. So good luck to everyone. Kudos to everyone. And it was just an honor to be here. Thank you for listening. And it's really been a pleasure.